Neurology Quiz number 12. What are the calcitonin gene-related peptide or CGRP antagonists used for migraine prophylaxis? CGRP is postulated to be involved in several steps of migraine pathophysiology, including dilatation of cerebral and dural blood vessels, release of inflammatory mediators from mast cells, and transmission of nociceptive information from intracranial blood vessels to the nervous system. Monoclonal antibodies targeting CGRP are novel treatments introduced for migraine prophylaxis. Erenumab is a CGRP receptor antagonist, while fremanezumab, galcanezumab, and eptinezumab target the CGRP molecule. They are effective for prophylaxis in both episodic and chronic migraine and are not used as abortive treatment. Galcanezumab is also FDA approved for prophylaxis of episodic cluster headache. All these agents are administered subcutaneously except for eptinezumab, which is given IV. Injection site erythema and pain is the most common side effect for the sub-Q agents. Erenumab can cause constipation, and eptinezumab can cause nausea and fatigue. What is the ice pack test in myasthenia gravis? This is a simple and safe bedside test with high specificity and sensitivity for distinguishing myasthenic ptosis from other causes. Crushed ice in a plastic bag or in a surgical glove is placed over the affected eye for 2 to 5 minutes, and improvement of the palpebral fissure of at least 2 millimeters is considered a positive test. Pre- and post-test eyelid positions can also be compared by looking at photographs. The test is a more convenient alternative to the edrophonium test. Cold temperature probably decreases activity of acetylcholine esterase and increases the availability of acetylcholine, thereby improving neuromuscular transmission. For this reason, when performing repetitive nerve stimulation, skin temperature at the recording site should be at least 33 to 34 degrees centigrade. Otherwise, cold temperature may mask the decremental response. This is an illustration of the ice pack test published by Liu and Chen in the New England Journal of Medicine in 2016. What is the disembarkment syndrome? This is a unique cause of dizziness that is provoked by boat and ship travel, but sometimes also by plane trips. It is more common in women who are usually in their 40s. Symptoms start immediately after returning to dry land. These symptoms are described as a rocking or swaying feeling by the patient without spinning, nausea, or vomiting. There is no change in hearing. Symptoms improve or resolve with re-exposure to the precipitating factor, such as returning to the boat or ship, or with other types of motion, such as driving a car. However, the symptoms recur on returning to land or after stopping driving. Most patients show spontaneous resolution after weeks or months, but in some patients, symptoms are persistent. Pathogenesis may be related to defective vestibular adaptation. Treatment is difficult. Benzodiazepines like clonazepam and SSRIs have been reported to be helpful. Anti-vertigo medications are not beneficial. Vestibular rehab can be helpful for some patients.